Hi, today topic is clinically important drug interactions. Here so many types of drugs are there. When you are administrate the ampicillin or amoxicillin with the combination of oral contraceptives like what are the contraceptives, oral contraceptives? Furosemide, hydrocortisone, prednisolone, beclomethasone, oral contraceptive drugs. They will be interacted and they having some side effect. They shown then amoxicillin ampicillin combination of amoxicillin and ampicillin with oral contraceptives are likely interacted with each other. So then the interruption of enterohepatic circulation of estrogen and failure of contraception will occur. Then risk of bleeding will be occur. And probenecid is taken with penicillin or any other ampicillin like carbaphallosporin like antibacterial drugs. Then the side effect like inhibition of tubular secretion will be inhibited and antibiotic action will be prolongated. Another drug allopurinol combination with ampicillin mercaptopurine, then it causes increased rashes and inhibition of metabolism. Okay, and then metabolism will be inhibited. Then what happened? Reducing the dose of the object drug. And carbacillin and ticarcillin with aspirin and antiplatelet drugs, then it causes the surface receptors on platelets perturbation and risk of bleeding. When the wound will happen, then it continuously bleeding will occur. No clotting will be seen when we take the carbacillin with the combination of aspirin or any other antiplatelet drugs. Ceftriaxone with oral anticoagulants. Ceftriaxone with oral anticoagulants will causes bleeding because it reduces the oral anticoagulants will be reduced by the ceftriaxone. Ceftriaxone decreases the oral anticoagulants action, so that's why it will be causes bleeding. And sulfonamides with phenytoin or warfarin causes inhibition of metabolism and phenytoin toxicity, because here two are like sulfonamides and phenytoin are not safe, so you must avoid this combination of drugs. It is safe. Metronidazole, tinidazole, cefoperazone with alcohol, it causes, we already knows what will happen when alcohol consumption is prohibited, because of it is very dangerous to us. But when you take alcohol with metronidazole, tinidazole, it causes accumulation of acetaldehyde and disulfiram Bijare reactions will occur. We already knows what is the Bijare means, type B. And then what will happen? Adhesive alternative contraception will occur, and patient not drink to alcohol is safe when consuming of the metronidazole and tinidazole. In another way, metronidazole and tinidazole is taken with the combination of lithium salts. Then what will happen means decreased excretion level decreases, and lithium toxicity will occur, and lithium dose will be reduces. So it is not safe to taking metronidazole, tinidazole with lithium. And ciprofloxacin, norfloxacin with the combination of theophylline warfarin. What will happen? Inhibition of metabolism, and also reducing dose of object drug. Erythromycin, clarithromycin, ketoconazole, itraconazole. These drugs taken with the combination of terfenamide, cisapride, phenytoin, carbamazepine, warfarin. What will happen? Inhibition of metabolism occur. And what happen means metabolism will be reduced and high risk of myopathy. So it will be avoided when using two combination of drugs like erythromycin, terfenamide. And also these about some drugs which, and so many drugs are there combination, it will be must and should avoid to. And another drugs, gemifobrigil, nicotinic acid with statins. What will happen? Increased risk of myopathy risk will be increased. So when you have administered the nicotinic acid, you must avoid statin drugs like atorvastatin, simvastatin. Like if you are taking statins, you have to avoid nicotinic acid. Any one will be preferred. Both are not taken as a combination of drugs. And tetracyclines, oral contraceptives. Tetracycline drugs and oral contraceptives are also not good combination. It also causes some side effects like failure of contraception and rise in lithium level and decreased excretion. So that's why you have to avoid the tetracyclines when you are taking the lithium salts. If you are taking oral contraceptives, then you have to avoid tetracyclines. Either when you are administrating the tetracyclines, you have to avoid the oral contraceptives. So the doctor also preferred to give the drugs which are contraindicated. He will be avoided this combination of drugs. And iron salts like calcium, antacids, these with combination of tetracyclines will causes absorption of formation of complexes will be decreased in gastrointestinal tract. And furosemide with aminoglycosides, what will happen? If we take furosemide and aminoglycosides at a time, it will be enhance vestibular toxicity. And diuretics will have, when we take in diuretics with the tetracyclines, that affect the urea production will be increased. And when you are taking lithium with the diuretics, what will happen? Excretion decreased and lithium levels will be causes toxicity, because rising in lithium levels it causes toxicity. And diuretics with the digoxin also not safe for the patient. It causes, what will happen means increased digoxin toxicity, then patient will be going to the coma. And tetracyclines with penicillins, it is also dangerous for the body. Clindamycin, clindamycin combination with erythromycin what causes the mutual antagonism of antibacterial action due to proximal binding sites of bacterial ribosomes. Phenobarbital and metronidazole combination of drugs will be causes loss of efficacy of drug, and it increase the dose of drug with monitoring. Chloramphenicol and warfarin combination of drugs will be inhibition, metabolism inhibited. And non-steroidal anti-inflammatory drugs with ciprofloxacin causes increased CNS toxicity like seizures. Aspirin and non-steroidal anti-inflammatory drugs causes phenytoin. What will happen means enhance the risk of bleeding due to antiplatelet action and reduced antihypertensive effect. It will be occurred when you have take the aspirin with spironolactone. What will happen? Reduced potassium conserving action due to decrease the tubular secretion. Chronic alcoholism with paracetamol. When a person have chronic alcoholism, then we take the paracetamol. What will happen means hepatotoxic will be occurred and liver will be damaged. Chloropromazine with morphine. What will happen? Enhanced CNS will be enhanced. And levodopa with angiotensin converting enzyme inhibitors. What will happen? Excessive postural hypertension and reduce the dose of antihypertensives. TCS with adrenaline causes potentiation. And promethazine diazepam alcohol, what will happen? Activate the additive the CNS and avoid the current use. Cimetidine and diazepam, it will be inhibit the metabolism and it causes CNS depression. Sildenafil and nitrates, what will happen? It also market potentiation. Propranolol with adrenaline, it causes increased in blood pressure. Due to increased blood pressure, it blocks the vasodilators. And propranolol with lidocaine reduce the hepatic clearance of lidocaine. Here lidocaine with beta blockers, what will happen? Decreased bradycardia. And with lidocaine, when we taken with quinidine, it causes cardiac depression.